I want to specifically speak this evening on a report that was published last month, the Healthcare Quality Indicators in the Irish health system, examining the potential for hospital discharge data. And I want to specifically speak on that because I believe it has implications for the operation of this particular piece of legislation and the interaction or lack of interaction that takes place between the HSE and the Department of Health. On the 23rd of February last, Ian Carter, the National Director of Acute Hospitals, in an interview with Susan Mitchell of the Sunday Business Post, when she asked if the HSE had examined the reasons behind the high mortality rates in some units, Ian Carter responded by saying, "Not yet." He said the HSE was only now validating the figures and examining whether there was a real variance or whether differentials could have been attributed to poor coding of data. He went on to say, have we had a systemic approach? No, we haven't, in terms of drilling down to individual hospitals. It has been slow, but the exercise is now happening on a hospital-by-hospital basis. His defence is that the report had just been published. Now, I think this is an outrageous admission by a senior official within the Health Service Executive, because this report was available to the Department of Health and to the Minister for Health and to the HSE 30 months prior to that. 30 months prior to that, when the Minister came into the House here and read part of that report into the public record, and on foot of that used it as a validation for his decision to close the Accident and Emergency Department at Roscommon County Hospital. But following the publication of the report last month, the Chief Medical Officer described the report as a burglar alarm. And he said that while not saying that your house has been ransacked, clearly it needs to be checked out. But while the Department of Health told the HSE to check the alarm, both organisations continued to let that alarm ring for 30 months before opening the door of the house to see what was happening inside. Ian Carter, as I say, said that the review was only now happening, 30 months after the information was compiled. And what is even more bizarre is that in March of 2012, Minister Riley told the House here that the reason that the report hadn't been published 2 years ago was because, and I'll quote, "The CMO, in conjunction with the HSE, is now in the process of further augmenting the analysis of the indicators to date with data from 2011 and 2012. Every public hospital in the country has been written to in order that they can ensure that the information they record and report for 2011 and 2012 is actually accurate." These figures were setting off alarm bells in the Department of Health in July of 2011, as per Minister Riley's comments here in the House during the debate on Roscommon Hospital. And yet, even after the follow-up with the hospitals, which clarified the figure in relation to Roscommon, those hospitals that were outside the norm, where stroke death rates were 4 times higher than some of the others, where the heart attack death rates were 7 times higher than the best performers. Amazingly, nothing was done for 30 months. Nothing was done to see what was the basis of those particular mortality rates. The Minister was happy to see that report lying on a shelf because he had fulfilled his short-term agenda, and rather than delving into the figures, which could have exposed weaknesses both within the HSE and within the Department of Health that may have caused difficult questions to be answered for him politically and for his department. Instead of doing that, the report was quietly set aside, put under the carpet. There was further analysis, we are told, carried out But the fact remains that the HSE is only now looking at those figures, and the Department of Health failed singularly to actually act upon that and ensure that the HSE had actually followed that through. Now, one of two things have happened here. Either the report does not give rise to the patient concerns, which means that the report itself is a work of fiction, or secondly, it is reflecting a problem at hospital level that has been sat on for 30 months. Now, one way or the other, both the Department of Health and the HSE need to come into this House and explain exactly which one is it. This revelation again raises serious concerns regarding Minister Riley, the Department of Health and the HSE. Their failure to act on the original data, their failure to act on the revised data, and it is putting the interests of patients behind the institutional interests of the HSE and the Department of Health. And isn't it funny? It sounds very familiar in relation to what we've just heard over the last couple of weeks in relation to Portlaoise Hospital, where local management failed to act. And because of that, the Minister has now brought in the Coombe Hospital in Dublin to supervise what's going on in Portlaoise. But in this instance, the senior management within the HSE, the Chief Medical Officer within the Department of Health, and the Minister himself had that particular report, for 30 months and failed to act on it, failed to ask the questions as to why those death rates were so high in relation to strokes, were so high in relation to heart attacks. And the people of this country and the patients that have gone into those hospitals need and deserve an explanation. And we need an explanation as to why those senior people with responsibility for the health service in this country failed to follow through on damning data that they got 30 months ago. Thank you.